Imagine walking into a pharmacy and finding out your prescription costs 80% less than it did last month. Sounds unbelievable, right? Well, that's exactly what former President Donald Trump says could happen with his new plan. In a bold and controversial move, Donald Trump has announced a sweeping proposal to cut the cost of prescription drugs in the United States, his strategy. An executive order that links American drug prices to the lowest prices paid for the same medications in other countries. This idea is known as the most favored nation, or in MFN pricing model. The goal is simple: to stop Americans from paying more than anyone else in the world for the same life-saving treatments. Let's break down what this means, how it's supposed to work, what people are saying about it, and whether this is really the solution Americans have been waiting for. But here's the catch. Drug companies are not happy. In fact, they're furious. The pharmaceutical industry says that tying US drug prices to international rates could hurt innovation. Their argument is that high prices in the US fund research and development for new drugs. They say if those profits are cut, it might slow down the creation of breakthrough treatments. They also argue that foreign governments have strict price controls that allow them to demand lower drug prices. These countries often operate under a single-payer healthcare system, meaning the government is the only buyer, so they have enormous bargaining power. If the US adopts this most favored nation pricing model, drug companies say they'll be forced to either stop supplying certain medications or raise prices in other countries to make up the difference. This plan is likely to face fierce legal battles. The first time Trump proposed the MFN policy, lawsuits quickly followed. Courts ruled that the Trump administration hadn't followed proper procedures, including a public comment period. This time, those same legal issues could arise. Plus, without support from Congress, it might be hard to implement the plan fully, especially if it's challenged as executive overreach. Some lawmakers, even within Trump's own party, are skeptical. They worry this could amount to government price fixing, which goes against traditional conservative beliefs about free markets. On the other hand, many Democrats have long supported allowing Medicare to negotiate drug prices, a concept similar to what Trump is now proposing. So, it's a strange situation. Trump's idea is more aligned with progressive healthcare reform than typical Republican policy. This crossover might help him gain some bipartisan support, but it also creates political tension. There are still a lot of unanswered questions about this executive order. For one, Trump hasn't said exactly how the pricing mechanism will be enforced. Will private insurers also be forced to follow these new prices? Will the rule apply to Medicaid as well as Medicare? And what about the timeline? Trump says prices could drop almost immediately, but in reality, the government will need to write detailed regulations, respond to lawsuits, and manage the transition. Experts say it could take months, maybe even years, before patients see any real savings. This announcement has restarted a larger debate in the US about how healthcare should be priced. Americans are increasingly frustrated by the high costs of everything from insulin to cancer treatments. Many are demanding bold changes. And Trump's plan, love it or hate it, is certainly bold. Some believe this is a much-needed correction to a system that's gotten out of control. Others fear it's too risky, too fast, and might backfire. So, what does this all mean? If implemented, Trump's executive order could dramatically lower drug prices for millions of Americans. It could put billions, maybe trillions of dollars back into the pockets of patients and the government. It could shift how the pharmaceutical industry operates, not just in the US, but around the world. But the road ahead won't be easy. The policy will face resistance from some of the most powerful corporations in the world. It will likely end up in court, and it could take years to see whether it really works. Still, one thing is clear. The conversation about drug prices in America is far from over. Affordable medication shouldn't be a luxury. It should be a right. Whether Trump's plan will succeed or stumble remains to be seen, but it has sparked a national debate we can't ignore. For many Americans, this isn't about politics. It's about survival. Leave a comment and let me know what you think. Should the US tie drug prices to other countries? Do you support Trump's idea, or do you think there's a better way to fix the system? Let's keep the conversation going.